Are you newly diagnosed with an autoimmune condition? Maybe a rare disease like vasculitis, or possibly just starting a relapse and wondering what this may mean for your future? I've had vasculitis since 2015 and suffered my first relapse in 2023, which was after a very successful course of treatment. So if any of this strikes a chord with you, you may be interested to hear what the previous year was like for me. I'll begin with some background. Before 2025, well, symptoms all started in 2015, maybe a bit before then. I was diagnosed in 2017 by neurology. Found myself in a drug-induced remission in somewhere between 2017 and 2019. That was by a renal vasculitis clinic. And that went on to me being in a drug-free remission between 2020 and the start of 2023. Unfortunately, I relapsed in February 2023, and that led to a failed different kind of treatment in April 2023 by Fourth Valley Neurology. Then another failed treatment October 2023 by Lothian Neurology. And then I found myself back with Fourth Valley Neurology and ended up having treatment denied in December of 2023. And at that point, I decided that enough's enough. I self-discharged myself from neurology and ended up purchasing a set of ear massagers to try and buy me some time until I could find some way to get treatment. I've done a video on the ear massagers. It's one of the earlier videos, if you're interested in that, and I may follow that up again with other videos later on. That brings us to the start of last year, 2025, in January. Not having any success trying to find an alternative route to some kind of treatment for this active condition. I had started making some notes in Google Calendar, and these are some snippets from it. So I started off by going to the GP to just ask what can be done, and the appointment was to find out, well, what's next with my ongoing vasculitis care, and also to see what's happening about this respiratory thing with my cough and the shortness of breath on exertion. Because these conditions, although they first appeared all together at the same time in 2015, they've always been considered as separate. I've got vasculitis and there's these other things, and the other things were never really getting taken care of. But 2025, I decided I really want to focus on getting everything looked at. So at the GP, all he could suggest is you need to go back to neurology for vasculitis, and my options are a referral can be made and sent in just to the general neurology pot and someone will pick it up, hopefully, or I can go back to the original consultant that I fell out with a while back. So I thought that the only way to do it, as the original consultant has always been involved with my care, whether she was directly named as the care provider or not, she's always been referred to, so I thought I'd just have to go directly back to her. And that was it, back to the original neurology consultant. That takes us into February. February started with a CT scan for respiratory, so that's the box ticked. Just have to wait on the respiratory appointment coming up next. I also found another vasculitis sufferer who was almost taken by the condition. She managed to get treatment just in time. Um, and there's another story to follow up with that. I'll create another video around that. It's really interesting to hear what happened there. This also led me to find out that there's a vasculitis specialist in Forth Valley, or at least a go-to person that deals with the occasional vasculitis patients as they appear, and he's in rheumatology. With that information in mind, I again asked my GP if he could refer me to rheumatology. So that was with a view to the rheumatologist assessing all of the other conditions that came on at the same time as my original vasculitis back in 2015, and to examine me and treat me for all of these things. I also wanted my GP to keep in mind that my blood pressure problem previously vanished. I was on no medication at all when my vasculitis was in remission, in drug-free remission. I was using no drugs at all. But now the peaks are controlled with medication, but I'm left with really bad lows when it comes on. I also have from time to time shown purpures on the skin. It's like a bruising on the surface of the skin. I've taken photographs of that from time to time when it appears. It's not that regular, just on the odd occasion. And shortness of breath, the fatigue levels, they all improved after the successful treatment, which is kind of hinting that the vasculitis treatment improved everything else, so maybe everything else was actually vasculitis. And it's not a purely peripheral nerve, non-systemic vasculitis that I have, but it is a multi-system, a systemic version of vasculitis. There's also the neck, shoulder and back pain, which is, as the months go on, becoming more and more of an issue. Can be quite unbearable at times, can't concentrate on any other thing. It's just the pain is always on your mind. Still unable to clear my throat continuously. We'll probably catch a few of them on the video as we go through. And the cough is still, it's really scary at times. The throat closes up and it's scary. It's still not fixed yet. So that was February. Into March, the respiratory appointment appeared. And from the CT scan, well, there's some ground glass features on the CT scan. We'll arrange another CT scan and see what happens. The breathing on exertion, maybe try and arrange another assessment for that. I was previously assessed back in 2017. That was when I was under quite strong treatments for the vasculitis. So that may have masked conditions or masked the measurements. So I wanted him to rearrange that fully. And the other suggestion was, well, maybe you should try morphine for the cough. Morphine. A year or so back, when I fell clearing snow in the winter, I cracked a rib or two. And it was fine as long as I didn't move. So I went, don't move. But when the cough comes on, there's nothing you can do to stop that. And the pain was unbelievable. So I had been using cocodamol, which did help with the pain. It allowed me about 2 weeks without coughing just enough time to let the ribs knit together, and then the cough could gradually be allowed to come back, because at the end of 2 weeks, with the cocodamol, the constipation was, oh, you don't want to know about it. And it seems that morphine does the same type of thing, but without the same levels of constipation problems. So, with that in mind, I started to make a note of when the cough was really bad, because it's a part of life, it's a normal thing just now. And to say how often it happens, I didn't really know. So I've started to make a note of that in the calendar. So that brings us into April, getting busier and busier. April Fool's Day. That was the first neurology appointment since 2023 by the original neurologist that I fell out with all that time back. Unfortunately, she does not want me to be treated without first having a nerve conduction study done, which I wasn't happy about, because nerve conduction studies are not really accurate enough or sensitive enough to show the progression. They can either show, yeah, you've significantly got worse, or you've significantly got better, but they can't show incremental changes. And if I wasn't happy with that, well, she'd be really quite happy to refer me to one of her other neurology consultants within the group. So I left that appointment thinking, okay, I don't want to do the nerve conduction studies again. They've been no use at all. Maybe I should just see someone else. But on the way back home, I started thinking, no, that's the wrong thing to do. I need to go back to that original neurologist, because she will be involved with controlling my care in the background. Whether it's another named neurologist that's in the foreground that I'm actually seeing, history has told me she will be in the background. So no. The next day I wrote an email asking to stay with her. Yes, I will stay with you. I don't want to be moved on to anyone else. And yes, I want you to arrange nerve conduction studies urgently. If that's the only option that's available, we'll go with that. Back with the GP, the blood pressure medication with methyl dopa this time. Were they causing me problems? I don't know. It seemed to be when I had a really low blood pressure, the stiff neck and shoulders would be much more intense. Certainly dizziness on standing, other stomach pains and things. Is it linked to the medication for blood pressure, or is it just the crazy blood pressure that I've got? Don't know. On the 11th, so we're getting through the month, I filled in the form to request medical notes from a GP. This usually takes a month, sometimes longer. And I was quite surprised. They actually arrived on the 24th. So that was great. So with the notes arriving, I thought, right, I'll do other things linked to the medical side of things. Trying to put it out of mind as much as possible, but okay. The notes have arrived, I'll see what else I can do as well. I called Lothian Neurophysiology to check if an appointment had been made for the nerve conduction studies. They had a look. Your name's on the list, but there's no date being assigned yet. So I must have been put on a list to then go on a list. Don't know. But anyway, half an hour later, they called me back. We've got a date for you. It's in June. In June. Okay, that'll do. And made a note in the calendar. That's 3 bad choking cough events this month. Keeping a note of it this time. moving on into May, the 11th of May, admitted in A&E, sickness, diarrhea, stomach pains. This was the first time ever that my blood pressure was actually low in hospital. Normally it's through the roof. This time round it was low. It's never been like that before. They gave me a pressurized drip. There was someone standing up on a worktop holding a drip up in the air, squeezing it in to try and bring the pressure back up. I was then moved to the acute assessment unit where my blood pressure, being regularly monitored, was normal all of the next day. First time ever in a medical environment that I've had normal blood pressure. So, wow, this drip has fixed everything to do with my blood pressure. Unfortunately, when I went back home and started checking it, it returned to the usual random very high, very low, very high, very low, my usual blood pressure. So it was a one-off in the hospital. So a few days go past, the 15th of May, and I'm admitted again. Again, sickness, diarrhea, sore stomach. This time, the surgical assessment unit. And I was in there for my birthday. Yay. We did an ultrasound to see if there was anything going on in my stomach area. We couldn't see anything. That's the same with all the tests that I've had for vasculitis. They've not shown anything. And they were going to do an endoscopy, but they couldn't get that arranged during the time that I was admitted, so that was arranged for a later date. And they discharged me in the evening, but that was the same evening that I had an appointment for another CT scan. So while I'm in there, popped along the corridor, got the CT scan done as well before leaving. May probably wasn't a good month. The 21st of that month, cat's out in the garden and got attacked by a passing dog. The attack was too severe. We had to have her put down. Bad things happen. Next thing in the list was the GP suggested trying beta blockers to help with the blood pressure. Slow the heart rate, that will reduce the blood pressure. So, okay, we'll give that a try, see what happens, because it's still all over the place. I also decided to create a Facebook group for peripheral neuropathy in Forth Valley. Peripheral neuropathy is quite a common condition. I have peripheral neuropathy due to a rare autoimmune disease called vasculitis, but peripheral neuropathy isn't an unusual thing, and it would be useful for myself and others with peripheral neuropathy to find out what everyone else is doing, how they're coping, have they found things that help. So it seemed like a reasonable idea to create a Facebook group for that and make a note in the Google Calendar. Only one choking cough event this month. Yay. Moving into June, nerve conduction studies. I went to Lothian. The consultant that carried out the nerve conduction studies. She mentioned that, yeah, in comparison to my previous nerve conduction studies, there's some areas have got a little bit better, but there's other areas that were previously better, they've now got a bit worse. So Has my air massager been helping? Maybe you hear it in the background. I've got it on just now. Maybe that's been helping, because the condition I've got is still active. My immune system is still attacking my blood vessels and my peripheral nerves, reducing the oxygenated blood flow to my peripheral nerves. They won't get better themselves. So maybe. I also took the opportunity to visit the Multiple Sclerosis and Oxygen Therapy Centre on their open day to see what that was all about, see if maybe that will help with the neuropathy. It looked interesting, so I asked them to put me on the waiting list. June, put it on the waiting list. Also, I'm starting to suspect really heavily that blood pressure medication is linked to, well, the blood pressure medication is there to reduce my blood pressure. And when my blood pressure goes really low, sometimes I get stomach pain, sometimes I get dizzy when I stand up, sometimes I get sparkly vision, sometimes the stomach pains lead to sort of emergency toilet visits, and sometimes it's a combination of all of those. So I started also noting the toilet visits, because maybe that is linked to the medication. It's worth recording it to see. And I then started to use morphine a bit more often to give me relief from the cough if I decided I'd had enough of the cough. I would use the morphine medication for maybe a day or two to give me a couple of days rest, and then go off of it again, because I don't want to become dependent on it. That takes us into July, where the endoscopy appointment that was mentioned in the surgical assessment unit earlier on in the year, that appointment came up and was cancelled because my blood pressure was dangerously high and they didn't want to go ahead with it. So back to the GP, and just wanted him to do something with my blood pressure, because I knew I had an appointment coming up at the end of the year for the respiratory breathing on exertion test, and I didn't want that to be cancelled. That had to go ahead. So GP, he decided he would ask cardiology for help with my blood pressure. He wrote a letter off, and he decided to increase my propranolol dose until some advice comes back in from cardiology. But not long after increasing the propranolol dose, I was just feeling way too ill, really bad. So I had to return to the lower dose. And that takes us on to the end of the month, and the respiratory assessment for breathing on exertion. And yeah, you guessed it, it was cancelled. Dangerously high blood pressure. No, we can't do the test. It's just too high. Need to get the blood pressure controlled. Went back to the GP again, and well, the response came back. Cardiology are unwilling to get involved with this case. So, being at a bit of a loss, the GP decided to, or suggested he could send me to hospital today and just get them to assess me for my blood pressure. because he knew when I arrived there, my blood pressure would be through the roof. It always is. So he sent me off to CAU, the Clinical Assessment Unit, and in there I found out that it's not cardiology that takes care of blood pressure patients in Forth Valley, it's endocrinology. Okay, that's useful news. A previous 24-hour measurement that had been taken probably a year before, maybe 2 years before, in the clinical assessment unit, they said that one was noted as being normal. And thinking back to that, I think that sounds really strange. But they're looking at the notes and I'm not, so I can't argue with it. So I went along with that, and their suggestion was they would arrange a new 24-hour blood pressure measurement just to see if anything's changed. And this is where a can of worms gets opened, because when I went back home I pulled out my copy of the notes, which I don't know if you can see them behind me in the background, up on the shelf. That wasn't a normal blood pressure measurement. We'll cover that in a future video, there's just not enough time to mention it here. So we're into August, and I sent an email to the GP, the endocrinologist, and to the clinical assessment unit about my blood pressure. This will all be covered in another video, but basically my blood pressure is not normal. Every medical professional that measures my blood pressure, you can see they go quiet, they measure it again, they try a different arm, they go away, get another measuring tool, they try it again. There's nothing normal about my blood pressure. We'll cover that in another video, but moving on. The 12th of August came round, that was the appointment to get the new 24-hour measurement done. Return it the next day. And back at the GP was asking me if I had a neurology follow-up. He couldn't find one. I hadn't had any letters. So after that appointment, I did some phoning around, contacted the neurology secretary to see if there was a follow-up appointment. And she told me she would check and get back to me. That probably means there isn't one. And getting back to me, there was one created for 3 weeks later. So next month. Taking us on to the 20th, I'm back in A&E again with these stomach pains. Before going to A, I didn't just go in there, called 111 first, and was told, no, take 2 of the morphine pills and go to A&E. 2 morphine pills for the stomach pain. I did mention that taking the morphine was for my cough only, and when I take it, it does give me stomach pains, but they just said, no, take the morphine pills, go to A&E. So that's what I did. In there, you wait for a while, triage sees you, they take some basic measurements, maybe to assess what priority to put you in, and then you sit back out in the waiting room for the next few hours. In that triage, they recorded another normal blood pressure reading. So that's the second time now in a medical environment that I've given a normal blood pressure reading. So I must have to be really pretty ill to have normal blood pressure. Strange. Anyway, as the time wore on, I think it was the early hours of the morning that I went in there. So, well, somewhere between 11 p.m., maybe after midnight. Eventually the pain faded around about 4 o'clock. I thought, I've got to get to work the next day. So I told her I'm going home. It's cleared up, the pain's gone, I'm fairly confident it won't come back. If it does come back, I'll come back in. I'm going home. Was it the morphine that helped? Did it just fade on its own? What caused it? I don't know. I didn't have any tests done apart from a finger prick test for blood sugar and blood pressure, which was normal. So we don't know what happened with that. It didn't come back. That takes us through the end of August and brings us into September, which is the neurology follow-up. But she still doesn't want to arrange any treatment until I have nerve conduction studies that show that I have clinically become noticeably worse, which I'm not happy about because I'm using the ear massagers to try and, well, sort of keep my peripheral nerves on life support until I get treatment to stop the vasculitis from attacking them. So should I stop the ear massagers to see if I do get worse? And if you do get worse, there's a good chance you won't get better from that. So I'm not happy about that. On the plus side, she did arrange an out-of-area referral to Fife Rheumatology. I had made some calls to find out about that, and Forth Valley Appointments, they were able to see that yes, a referral had been made. But there's more to that, and that will come in a follow-up video as well. Moving on, I received a letter from the acute assessment unit. This was saying, my blood pressure is completely normal. Not happy about that, because I know it's not. I thought, okay, I'll use that to my advantage, and I emailed respiratory with the news, saying that my blood pressure is normal, and could they then request another breathing on exertion test, seeing as how I have completely normal blood pressure. See if that works, because I'd really want to get this breathing on exertion test done. It previously did show an abnormal heart response, and there was a suggestion that it should be seen by cardiology, which didn't happen, it just got lost. I also saw my GP and asked him if he could do a Sjogren's blood test, because these strange symptoms that I've got don't seem to fall in line closely with other vasculitis sufferers. The peripheral neuropathy, yes. Cough, no. Blood pressure all over the place, no. Dizziness and standing, swallow problem, no. None of that. So that feels like it ties in with Sjogren's, and I've got a suspicion that it could be a primary Sjogren's that I'm suffering with, which maybe has a secondary vasculitis in it. Anyway, I asked the GP to run the blood test for Sjogren's. But then I found out later the blood test that he did was just a standard blood test. But it was still quite handy. There was information in that was quite useful. Again, that'll probably come out in another video. We'll go into it here. Next thing was to reduce the blood pressure medication. Seeing as how my blood pressure is completely normal, and using blood pressure medication simply lowers my blood pressure much more than it should be, I reduced the blood pressure medication and then stopped it. that ties in with the advice from the acute assessment unit. Next thing to try, well, I'm running out of stuff, so let's try this CBD thing to see if it helps. Cannabis-based, we'll call it a medication, but it's not officially a medication. Cannabis-based supplement, which has the narcotic side of it removed. So you don't get a high when you're using it, but hopefully it may calm down my fight or flight response and try and bring me back into rest and digest. We'll give that a try. I started with the patches. It was just a 1 week supply of patches, and at the end of that week I didn't notice any change, but as far as peripheral neuropathy goes, 1 week is a millisecond, it's no length of time. But they weren't really agreeing with me anyway, so I switched to CBD gummies to see, well, just to try and continue on the CBD thing and see if that does anything for me. After that, I received a letter from respiratory that sounded like they were discharging me. So I sent a letter back asking for clarification, and ended the month with a strange heart buzz palpitation thing that I get from time to time. Make a note of that. We'll see how regularly these things come up, because I'd never recorded it before, but I knew previously I'd had them. So made a note. Taking us into October. Well, trying to get out and about. It's October. Let's get out and about. Try and get more active. I tried a hill walk up the one of the local hills called the Demayat, which is a bit of a cheat because you can drive most of the way up and then it's just a short walk up to the peak. Didn't manage that, unfortunately, but it got me out of the house for a bit, which is a good sign. It's getting me out, getting me moving. Decided to increase the CBD gummy, we'll call it a dose, CBD gummy dose. See if increasing the dose gives more of a noticeable effect. And finished the month by sending a letter off to neurology asking her to reconsider her condition, not to treat without nerve conduction studies showing that I've got worse. What's the worst that could happen? It's worth a try. That's taking us into November. I had a much bigger heart buzz thing. This time chest was pulsing like mad. It was a quick pulse. Tongue pain, like it was something tearing my tongue. My eyesight, the straight ahead vision went. I could see everything apart from right straight ahead. So I got up to have a look to see what's going on with my eyes in the bathroom mirror, and suddenly hit the ground. Passed out. Got up. I don't know how much later it was, but made my way into the bathroom and I could see straight ahead. It was as if I couldn't see my eyes when I looked straight ahead, but if I looked sideways, I could. There was something wrong straight ahead, which was quite worrying. But after about half an hour, that had all faded. The tongue pain went after the eyesight came back. It's not came back again, but I've made a note of it just in case it does. That was November. A sort of calm-ish month, but, well, taking us into December, I made a phone call to the acute assessment unit consultant's secretary to get the secretary to ask if the blood pressure that I have is okay for attending hyperbaric chamber treatments, because my request to join in with the multiple sclerosis and, I forgot the full name of it now, oxygen therapy centre using the diving chambers. Excuse me. That appointment had came through, and that would be starting in the middle of December, so I just wanted to run it past the consultant that said my blood pressure was completely normal. But I got no response. And I also decided to change from the CBD gummies to using CBD oil. CBD gummies, it's like a packet of sweet gum drop things, but the sugar is intense. So I wanted to move away from the high sugar content. I'll try moving on to the oil, see if that works. So I started with the 10% oil. It's December, so it's cold and flu season. Previously, I was sent out appointments for COVID and flu vaccinations, but this time I had to arrange one on my own. And well, this is because I'm no longer receiving immunosuppression treatments. But my GP did advise me that I really should try and get vaccinations for these, even although the NHS aren't arranging it for me. The other thing that happened was the breathing on exertion test was rearranged. Right at the last minute, they said they could squeeze me in if I could come along, but there wouldn't be time to send an appointment out for me, so yes, let's go with that. But again, you still couldn't do the full breathing on exertion test where you're on the bike with the mask measuring your breathing and with the leads attached to your chest to monitor your heart, but they could do a walking test. So I wasn't sent home with nothing, but still they didn't monitor the heart, which was the problem the last time. And that was down to dangerously high blood pressure, again in excess, 250 over 130 or around about there, before any exertion. And December ended with my first day trying the hyperbaric oxygen treatment chamber thing. Had some problems clearing my ear, not used to doing this type of thing. I haven't done much swimming. But apart from that, it went reasonably well. I haven't noticed any positive effects from it yet, but I'm going to give it 6 to 8 weeks, which is the normal treatment time for a broken bone or a wound to heal. So we'll give it time. And at the end of December, I increased to 30% CBD oil. And if I see an improvement, is it the hyperbaric chamber or is it the oil? Okay, I can cut the oil out and see if I still continue with the improvement or if things get worse. And that takes us to this month, January 2026. Called Forth Valley appointments to see if I've got anything listed, any appointments listed coming up. There's nothing in for neurology, but they could see the referral for 5 was in there, okay. But I've still not received an appointment from 5, so I called NHS 5 to confirm the appointment, but they've got nothing listed. So thinking back, again I'll have to do a video on it, when I was trying to get my GP to create an out-of-area referral for me. Turns out in the NHS Scotland, your GP is not allowed to refer you to a consultant at the local hospital, but not out of the area, not to an adjacent hospital. And I found it was the public health department that has to arrange that. They've got to agree to an out-of-area referral. And when I contacted them previously, the public health department, they said, when we receive the referral request, it only takes a few days to approve. And so with that in mind, I contacted the Forth Valley Public Health Department about my out-of-area referral that had been created by the neurologist in 2025. They had a look and said, yeah, we've approved it, and we sent it back to neurology for them to send it back to 5. So the neurologist hasn't gone through the full normal steps of creating the out-of-area referral. This is the neurologist I had previously complained about because of doing similar things to this. So there's a video to follow up about that as well. You won't believe that. So trying to decide my next steps, well, what do I do? Instantly after finding out that public health had approved the referral, I thought I'm going to contact neurology straight away. But then I thought I'm basically going to be contacting them to tell them what they already know. Where's the benefit in that? Apart from them thinking, oh, okay, he's found me out, I will forward it on. So I either contact them and tell them what they already know, or I let them dig a bigger, deeper hole. It means I'm going to be without treatment for longer, but my last treatment was around about the middle of the year 2023. 2024, 2025, we're into 2026. After 2 and a bit years of no treatments, what's another few months going to do? I'll keep going with the air massagers and the hyperbaric chamber treatments and my alternative CBD stuff. And I think we'll allow this neurologist to dig a really deep hole, and hopefully it'll be so deep that she won't be able to get back out of it, and she'll leave my case alone and allow me to actually receive treatment. But that's just my thoughts on it. Anyhow, that's the review of the year. If you've continued with it this length of time, thanks very much. You've done well. If any of this resonates with you, let me know in the comments if you've had something similar. Tell me about it, let others know that I'm not the only one and that you are also not the only one. Let others know. And we've got a few other videos to create now, so we'll see you in the next one, which will be much shorter than this. So thanks for sticking with me all this time. Until the next one, speak to you again later.